under this Apollo campaign of Heartfully Restore the Core, today we'll discuss a condition called severe aortic stenosis. Severe aortic stenosis is a structural heart disease problem wherein the aortic valve, which is supposed to open with each contraction of the heart, is unable to open and it's severely restricted or blocked, where heart has to work very hard to pump the blood out and nourish the rest of the body. If this obstruction or severe aortic stenosis is not relieved either by a surgical removal and reimplantation of a new valve, or much better and safer and simpler procedure called TAVR, that is transcatheter aortic valve replacement, the mortality, that means the risk of death, is significantly higher. Aortic stenosis is not treatable by medicines and it has to be treated by replacing the valve, either through surgery or transcatheter treatment called TAVR. As one ages gracefully, the aortic valve starts becoming restrictive or narrowed. This condition is called either aortic sclerosis or stenosis. People above the age of 65, about 3 to 5% of them develop this aortic stenosis. The ones who are 80 years and above, 10% or more will have significant aortic stenosis, leading to heart failure, worsening quality of life, or even the risk of sudden cardiac death. So it's very important to ask your doctor, what is the status of my aortic valve whenever you go for a checkup if you're in this age bracket. As we all know, the only treatment for severe aortic stenosis is aortic valve replacement, either through surgery or transcatheter called TAVR. It is important to seek the centers of excellence to have the best outcome in terms of improvement of quality of life, reduction in death, by going through a heart team approach where you have very specialized team of doctors, interventional cardiologists, cardiothoracic surgeons, vascular surgeons, cardiac anesthetists coming together to give the best outcome in that single attempt that one has to have a very well restorable core or the heart. At Apollo Hospitals, we function as a heart team when it comes to valve disorders. So a group of cardiologists, cardiac surgeon, anesthetist, pulmonologist, vascular surgeon, radiologist, everybody goes through that one person's clinical status, imaging, and then conclude a treatment plan with a lot of concurrence. Once that is done, a very well structured treatment plan is put in place, and most of them come together for that one particular hour of therapy to give the greatest outcome. We at Apollo take pride in being one of the premier centers of excellence for performing aortic valve replacement through TAVR or TAVR, transcatheter aortic valve replacement. We have great experience in doing the TAVR in the most vulnerable, means very frail, who's been about 38 kilos, somebody who is 94 years old, or someone who's had a previous kidney transplant, cancer survivor, previous bypass surgery, and had a valve replacement and had to do another valve. And we also have performed such cases where there are no blood pipe access to the heart conventionally through the leg, but the procedure is done through either the hand artery or the neck artery. So we are a center of excellence when it comes to transcatheter aortic valve replacement.